definitely I will get you to the important part of the human body is spine as well, which connects the
Sure.
brain and to so we will have a conversation on that. But thank you for doing
Exactly.
this on a weekend.
Spine is obviously a very, very important organ and very, very important structure, which is very, very closely related to the brain. So we all know that spine is the one that makes you stand erect and spine is the one that makes you walk.
When people put on weight, when they are obese, and one common problem which is on the more belly fat or more they become obese, the pressure on the lumbar is actually more.
So God has designed it in such a beautiful way that you have a S-shaped spine. It's not like a straight, rigid spine, right? So you have
Straight.
curves.
Pregnancy. So during pregnancy, definitely there is a lot of weight because of the growing fetus, and there is the 10 months of. So there is an impact on the spine.
It's a very, very common symptom, right? Everybody keeps saying that once I became pregnant, I started getting back pain. They gave me spinal anesthesia in the back, and then the back pain started. It's not necessarily true always, Naga.
With this current generation, like a lot of laptops and working involved during the childhood, the cervical spine is actually abused by the use of mobile the last 10-15 years. But I think today it's so much, but everybody is like this. Have you seen such impact?
It's not a question of structure, Naga. What has happened now is that if you're asking me how much of that has changed, it's changed significantly. I see so many children coming to us with neck pain, which probably would have never seen because the children were playing outdoor sports, right? They would play football, they would play badminton, they would play cricket, whatever sport, and they were doing all kinds of activity. Now, like you said, if you go in a train, bus, or go home and sit in front of family, all of them have their own gadgets and everybody is looking down. Nobody is even talking to you, looking at your eye. So that's not good. So if you unnecessarily keep bending and you are continuing to smoke, the degeneration sets in much faster and you can have significant problems. People don't realize, they always think smoking means it affects only the lung and the heart. Not necessarily, it affects a lot of other organs, and spine is a very, very important structure that gets affected in patients who smoke regularly. So there was this big fear and myth that if you do spine surgery, you'll never be able to recover. It will always keep coming back and you'll not be able to do your activities.
If you liked this conversation, please hit the like and subscribe button to get the latest updates from my channel, Caffelogue with Naga. If you made it this far, you're clearly into deep, meaningful conversations around health, lifestyle, and the science behind how we live. 60% of people who watch these episodes haven't subscribed yet. If you enjoy these insights, my humble request is to please consider hitting that subscribe button. It will help us bring much more curious minds, expert voices, and keep the show going strong. Thank you. Welcome to another episode of Caffelogue with Naga. Today's conversation is going to be very personal. As a child who has gone through a major spine surgery, I wanted to create awareness about spine health through this conversation. Spine is more than just bones. It's the highway to your nervous system, the support that lets you stand tall, move freely, and live your life fully. As a child, for me, who has gone through a major spine surgery, for years I had to go through the pain, limitations, and uncertainty. That experience has taught me how critical spine health is and how much courage it takes to heal. In our earlier conversation with Dr. Raghuram G, we traveled deep inside the brain. We talked about dopamine, deep brain stimulation, and the breakthrough technologies that are changing lives. Today we are flipping the script. We are moving from brain to back, from neurons to vertebrae, to talk about something that affects millions, but it's ignored until it's too late, the spine health. So without further ado, let's welcome back Dr. Raghuram G to our show and deep dive into the world of spine health. Thank you so much, Doctor. Welcome back to my show, Caffelogue with Naga, and I'm really honored and happy to have you back. While we started with brain and we are back with the spine. So again, happy to welcome Dr. I mean, I'll just for people to get to know because we have talked earlier. So Dr. Raghuram G, he's the director of neurosurgery and head of Stereotactic and functional neurosurgery at Krishna Institute of Medical Sciences in Mahadevapura, Bengaluru. So I think we spoke or we deep dive into human brain. We spoke about Parkinson's, epilepsy, and how dopamine plays an important role. And how cutting edge neurosurgery is transforming lives. So today we are shifting from brain to spine, so the body's core support system, so to explore the whole new world of challenges. So before I get into I just wanted to quickly start with at this
age in 2025. What is that is happening in the I know neurosurgery is a lot to talk about, but we spent a lot on brain. But just to quick start, what excites you most about the advancements in spine and back in right now? So maybe we'll start there, doctor.
Thank you, Naga, for having me again. It's been a pleasure to have the podcast previously on brain and the Parkinson's disease and dopamine. So it is spine is obviously a very, very important organ and very, very important structure, which is very, very closely related to the brain. So we all know that spine is the one that makes you stand erect, and spine is the one that makes you walk. So that way, spine is a very, very interesting and important subject in all neurosurgeons' career and life. If you ask me what excites me that is happening right now in spine, obviously there is a lot of advancement in terms of advanced tools that we have started to use in spine surgery. It could be a minimally invasive spine surgery, or it could be what we call as navigation guided spine surgery. So the whole idea of any kind of a surgical procedure is obviously to make it more safer for the patient and get better outcomes. So in terms of reaching that, there has been a lot of advancements which have helped us in terms of good optics of the microscope, improvement in neuronavigation techniques, and also using minimally invasive things, which makes the patient to get back to his routine work much faster. So there was this big fear and myth that if you do spine surgery, you'll never be able to recover. It will always keep coming back and you'll not be able to do your activities. So that has completely changed, and that's what excites me. And even though I've been practicing for 30 years, close to 30 years now, I think the exciting field is right now to be in, whether it's neurosurgery or spine surgery.
True. I think when you said that note that once you do spine surgery, it's going to be a lifetime impact. So it's a very, when I talk about spine, it's a very personal journey for me. So in '93, I had my very major spinal cord operation. So in L4 and L5, so due to an injury, but it's a long journey. So to get it, it took almost a year for us to even get into a space of diagnosis at that point in time with the MRIs. The first MRI I took is in '93. So after 1 year of kind of going through with multiple different uh, I would say with different specialties. But I think that my parents, I have to thank my parents to have gone with that almost a year or more than that, like 2 years to figure out, and then got into. But I think that's a so from then to now, I know how important posture is because I couldn't play when during my childhood for almost 4 5 years because I was at belt and was upside down for a while, and then it took a lot of effort and courage for me to get into a active mode. I have 2 kids now, but I think right now I think I'll share you the MRIs offline. But
It's interesting.
the
Yeah.
I understand it is not like that, but you can actually manage back pain with proper posture and exercises. So I think the this conversation is very very personal for me. I want to actually talk how a lot of abuse happens without knowing. So as a neurosurgeon, you would have seen. So I wanted to share that for the audience. So thank you for doing that. And I always learn a lot. And talking to you, I mean, brain was an eye-opening discussion. I think there's a lot. So I think this is going to be one more. So moving from what you told, that's the exciting space to be at this age. So the chronic back pain is an increasing among young people in India or even globally for that matter. Everybody says about chronic back pain. So I want to start there, right? So there is a lot of difference between chronic and acute back pain. So maybe why is this happening at this point, and probably what are the unknown causes which every individual is actually doing hurting their back, especially on the lumbar area. So maybe we'll start there, and then I think maybe I have question on the anatomy of spine. So we'll move there. So I just want to start with that chronic because it's very common. You would see that very often, even the young people in 20s or even teenagers. So
Absolutely, Naga. I mean, it's very, very well known now. I'm sure there is no individual on earth who has never had a back pain. So it's something that is as common and as commonly seen as anything else in the world. So it's everybody at some point in time will definitely get backache. So there are two types of backache, like you said. One is what is called as an acute backache. That happens after there is some kind of an acute insult or injury to the back. So which can be like you traveled for long, or you just moved something that is very heavy, or you lifted something that is very heavy, you slipped and fell down and fell on your back. So all these things, which there is a trigger factor which causes this, and there is an immediate pain after that trigger factor, is what is called as an acute back pain. So when we are talking of chronic back pain, that is what we just now, which you described, is mainly about posture. What are the kind of work that you do, how much you travel, and what is the kind of travel you do. So all these are the things that go into describing somebody who has got chronic backache. So if you are a person who is constantly sitting all the time throughout the day, never gets up, has a bad posture, keeps your workstation or a laptop at an abnormal height, then not only the lower
Right.
backache, even your neck will get affected. Or you are somebody who is traveling all the time throughout the day. So you are somebody who has to go to multiple sites in a day. You are stuck in traffic, or you're using two-wheeler and other modes of transport to reach that particular place, and you're traveling like 4 to 5 hours in a day, then obviously there is a lot of stress on the ligaments in the back and the discs that are there in the back. So when this happens, obviously that leads to chronic backache. So chronic backache is a very, very difficult problem to solve. So unless you address the root cause, which we will discuss over the course of this podcast, it won't get better. So it's not just the surgical treatment or not just the medical treatment. There's a whole lot of lifestyle change and exercise that goes into treating chronic back pain.
Right. I think I think I noted this quote from Stuart McGill. He said genetics loads the gun, exposure pulls the trigger, and the social context influences the response. So I think when you said a lot of times people uh, don't understand the chronic and acute, and also they feel that chronic back pain is something which they have to live with. So do you think that's a misconception which generally people have?
Absolutely. So it's just that they feel that it's part of their life, like I was just telling you. So there is nobody who does not have backache. So people think, okay, I can't do anything. It's just my way of life. They don't want to do anything to correct that. So that's not right. So we are in a space where we can identify the cause, even in chronic backache, try to suggest remedial therapy. It does not have to be surgery. So it's definitely not that every backache will I operate. No, definitely not. Like you
True.
said, the most important thing, the first important code that is there in our book of surgery is to know when not to operate. So that is what
Mhm.
defines a surgeon. That's what defines a good surgeon. So that is actually the first code that is there in all our surgical books. So you have to know when you don't have to use the knife. So that is very, very important. So this fear among the lay public is that if you start complaining, or if you start going to go for investigation or test, it will ultimately end in surgery. So that is the commonest fear that many of our peers and colleagues and family and friends have, that, oh, if you go to the doctor, they will find something wrong with you, and then they will say you need surgery. So that's not true. So you need to address the chronic backache problem. Please do not ignore it. There are very, very good solutions and therapies for it which you can do.
Got it. So the next question I have, let's start with the anatomy of the spine, doctor. So we have spine is split into three parts: the cervical, the thoracic, and the lumbar. So the major, so there is, I think the way in which I think you will be better to explain. So what I understand is that in the cervical is where there is a lot of movement. So the compression is less, but when you go down in the lumbar, there is less movement, but there is more compression, because that's why it's able to withstand the load, and a lot of uh, carrying or probably weights which you lift is able to support it by the lumbar. But most of movements and all that it's supported, that's why this part is more flexible, and so that's how what I understand, right? And most of the impacts what we see from a back pain standpoint is on the lumbar and to the S1 to S5, or sometimes to connected to that. So maybe walk us through the anatomy of
Yeah.
the spine, and why sometimes the people complain about back pain. It's not just always is the lower back, or it's all not always upper back, right? So maybe it's all depending on the wear and tear of the facet joints and different.
So obviously spine is one of the most important structure. Okay, so once we became from quadruped to biped, that is the key thing, right? You have a spine even in quadruped animals. So once we became biped, that means people who use two legs to walk. So then the stress on the spine obviously became much more. So your hands are no longer used to walk, or you are not bending forwards and walking. So your lower back, or the lumbar region, like you clearly said, is the one which is taking the stress of the head and the upper back and transmitting them to the legs. So that's why you see a lot of compression or lower backache problem. What is the difference between cervical, thoracic, and lumbar? See, the main important thing is the cervical thing, like you said, is an area which is very, very mobile. That's the way God or nature has designed it. So the extent or the degree of movement, if you're talking of physics, is very, very high in terms of cervical spine. And when you came to thoracic spine, it is rigidly bound by your chest and the thoracic cage. So the degree of movement in the thoracic spine is extremely low. And when you come down to the lower lumbar spine, the degree of movement is between the thoracic spine and the cervical spine. But the fact that as a biped and you're walking, the gravity and everything is stressed on your lower back, that's why you see more of compression problems in the lower back. It's not necessarily that you don't see cervical problem. You do cervical problem also you see, but they express themselves or behave themselves in a different way compared to the low backache. And coming to the anatomy of the spinal cord, so this is the kind of a model of the spinal cord or the lower back bone or the thoracic bone. So what you see in this is this thing is the bone. And between the two white bones, which you see a transparent structure, that is called as the disc or the shock absorber. So in the lower back, that is what which is taking maximum amount of stress that comes on your lower back. So that is what it has, a center jelly-like substance. And so when you bend or when you move, this jelly moves and takes the load in such a way that the stress is dissipated uniformly across the lower part of the lumbar body. So that is the advantage of this particular cervical disc in the lumbar region. Similarly, there is disc in the upper part, in the thoracic part, as well as in the cervical part. And this is the back of the spine. So in the back of the spine, you can see this yellow color, that is the spinal cord. And you can see these two yellow structures that are coming out on either side, and that is what is called as the nerve roots. So this is the basic structure of the spinal cord in all human beings. Cervical also, it will be similar. There is a spinal cord in the center and the nerve roots which are coming on the side. Between the two bones, there is a disc. So this is a uniform thing that is there. There are some minor modifications, like you were talking about the facet joints and all that. The facet joints in the neck are different. The facet joints in the thoracic spine are different, and the facet joints in the lumbar region are different.
Got it. That's why when people put on weight, when they are obese, and let's say one common problem which is on the more belly fat, or more they become obese, the pressure on the lumbar is actually more, right? Or the back. So that's why the lower back pain starts coming through, because you are overweight and the spine is not able to handle the load.
Correct. So I'll just explain that to you quickly. So what happens is you have normal curvatures of the spine. Okay. So God has designed it in such a beautiful way that you have a S-shaped spine. It's not like a straight, rigid spine, right? So you have curves. So in the front, it is called as kyphosis. As in the lower back, it is called as the dorsal kyphosis. And when you come to the lumbar region, you have what is called as a lordosis. That means the spine is bent forward like that. So when you have an abdominal fat, or when you become obese, this excess weight in turn will increase that curvature, and when that curvature gets increased, there is more pressure on the discs and more pressure on the nerve roots. So this spine is not only just bone and nerve roots, right? It has extensive musculature all around. So that is very, very important that we need to remember. So all these points in the spine that you're seeing, the spinous process, the facet joints, there are muscles all around this. So they all go into a stress when there is an obesity or a central obesity, or the belly fat becomes more and that lordotic curve becomes more. There is more and more pressure which is causing this nerve root to get stretched or the muscles to get stretched, and that's why you see more back pain in patients who are centrally obese.
Yeah, got it. So I think this is something which I read about also, that applied load deformation. So that is again caused because of constant increase in terms of the load which goes into your lumbar area, where it's not able to maybe it's slowly, let's say somebody's powerlifting for a while, and then probably they're damaged it, or probably doing weights without having the right posture. And also one more thing I want to pick your brain is on the pregnancy. So during pregnancy, definitely there is a lot of weight because of the growing fetus, and there is the 10 months of, so there is an impact to the spine. So how do you think? So there is a lot of women who continues with back pain for a long time. I don't think so they get better or they come out of it, and also because of the epidural during the birth.
Correct.
So
So let me just address that
what
quickly,
would be
because it's a very, very common symptom, right? Everybody keeps saying that once I became pregnant, I started getting back pain. They gave me spinal anesthesia in the back, and then the back pain started. It's not necessarily true always, Naga. I think that's a myth that we need to bust for many people. So what happens in pregnancy is, again, there is an obesity, right? There is a central obesity. The fetus is growing, your uterus is getting big, so you have a big abdomen coming in the front. But the way it is designed is all the ligaments that I was just telling you, muscles and ligaments which are around this, are also influenced by the hormonal changes that happens during pregnancy. So they all become lax. So they all accommodate. Unlike somebody who is having a chronic back pain because of abuse of the back, this is not an abuse of the back. This is a natural phenomena that happens in every woman, people who get pregnant, right? So there is a compensatory mechanism that happens throughout the body during that time, not only in the back, in various organs in the body. So that way, during pregnancy, even though they get a back pain, that will go away once the pregnancy happens, once the delivery happens, and they lose the weight. If you don't lose weight post pregnancy, you continue to gain weight or you continue to maintain the same weight, that's the time when this challenge happens. So that's the time when the stress again, because the hormone has gone away now, all these protective pregnancy hormones that were there are all gone, and you continue to have the weight. That's the time when you start getting more back pain. It's not that everybody who takes an epidural anesthesia for pregnancy or labor will develop back pain. That is also
Will
another myth.
develop
Yeah. So it is
myth.
not true. There are many people who will have no back pain just because of epidural. So some of them may have some scarring. So it's like a medicine, right? So it's given very close to these nerve roots that are there here. So if that happens, then they can have a irritation of the nerve root and chronic back pain.
Got it. True. But I think, yeah, that's a common myth, right? Because I know it's not, people don't realize that it's because of the weight. They continue to keep it after pregnancy as well, because there should be a constant effort to reduce it. Because even an obese person is actually, even if it's a man, is going to have the same impact if you have that weight. It's not just after the pregnancy effect, but there is myth which I say everybody just says attributes that back pain to because of the childbirth and the pregnancy effect. Yeah, I think as you say. Um, Again, on going back to your evolution on the spine surgery from minimally invasive and robotic procedures, and you said AR guided and endoscopic
Correct.
fusions, right?
Correct.
So how do you see
Yeah.
that evolving at this point, right? I mean, how much success we see from those, and how it's helping, right? Maybe you want to give some details about some examples and,
Correct.
and
Correct.
share.
See, that's what I'm saying. So it has definitely evolved over a period of time. See, from when we started, we didn't even have good MRIs or good X-rays, right? So now the availability of MRIs and the resolution of these MRIs have significantly improved. So we are able to identify what is the pathology or the disease better. I think that's what I think even in the brain we discussed that, right? So all these
Hmm.
technological advancements have significantly made us to identify the root cause of that particular back pain very, very clear. Is it like I told you, the back pain need not have to come always from the cervical disc or the lumbar disc or the bone or the nerve root. It can come from so many other structures all around
So
this
many.
place. So these MRIs and other investigations that we have now and the advancement in the resolution have definitely helped us to narrow down and pinpoint the exact cause of the particular problem. So previously what we used to do, the surgeries used to be much more radical. That means we used to do a bigger incision, we used to open fully, we didn't have so
Right.
much advanced microscopes. So that's the time when people were really scared and said that, oh God, once you do a surgery, your back will ache forever, you'll never get better, you'll not be able to walk, you'll not be able to get back to your usual life. To that, it's gradually evolved over the past, say, 30 years. And for the last 5 years, we have seen significant growth, whether it could be endoscopy, in which we use a scope which will magnify more than a microscope, go into the area of interest, and then remove only that abnormal part that is causing the pain, or robo assisted or robotic assisted spine surgery, which I also do now routinely, is the time in which when
Hmm.
we have to put screws into these bones, right? We do what is called a pedicle screw for a very particular kind of a problem that the patients will have, like which could be degenerative. We will discuss that and as an
Right.
example.
Right.
So those conditions, the robos have significantly improved the safety and also reduce the amount of radiation both for the doctor as well as for the patient, because that is
Hmm.
another concern, right? So when we want to put these screws, we have to put them in the bone and we don't want to touch the nerve. So we use what is called as X-ray or image intensifier in the OR. So when we have robots and other guided tools, the amount of radiation that we expose the patient as well as to the doctor or the surgeon becomes significantly less. So that is another important advancement that we have seen.
If you made it this far, you're clearly into deep, meaningful conversations around health, lifestyle, and the science behind how we. 60% of people who watch these episodes haven't subscribed yet. If you enjoy these insights, my humble request is to please consider hitting that subscribe button. It will help us bring much more curious minds, expert voices, and keep the show going. Thank you.
Now, on the MRI as well, from the imaging output, do you see, like, let's say from 10-15 years back to now, the kind of output, it's also more advanced to an extent to identify the
Absolutely. See,
patterns, or
previously we
what
had
where
what is,
exactly
yeah,
the
previously we had a
yeah.
lower strength magnet, right, which was like 0.75 or 1.5 Tesla magnets. So now we have even 3 Tesla and 7 Tesla magnets. So with that magnet, the resolution of the images are much better, and all of these machines of MRI, they basically run on algorithms and softwares, right? So the more refinement in the algorithm, the more refinement in the software, we have found that the image quality significantly improves. And like you were saying about facet, right? So we can clearly see that there is a facet arthrosis or there is a compression of the nerve around the facet. All these things we can very, very clearly identify and probably treat them appropriately.
Hmm. Got it. I think and one more question related to the MRI I want to ask. I think from us, if somebody who is very actively in sports and they're actually doing a lot of physical activity, which there is a constant impact. I'm not saying impact to the brain, but there is an involvement of bending and all kind of activities, right? So, do you think yearly an MRI is advised? Or I mean, again, a myth of doing an MRI is actually an impact to your health, or you are exposed to radiations is also a concern. So I wanted to get your perspective.
So I think that is something that we need to clarify to all our audiences is absolutely it's safe. MRI has zero radiation. Okay. So
Mm,
MRI is something like a magnet which sends magnetic waves, and we see the tissue response, how the molecules in the tissue respond, and based on software algorithms, we have images. So there is no radiation whatsoever at all. It is safe to do even in a
mm,
1-year-old child, safe to do in a pregnant lady, safe to do in an 80-year-old. The only contraindication is if you have an implant for whatever reason, like you have had a
mm,
fracture before, or you have had some kind of a surgery in which there is a stainless steel or a magnetic implant,
right.
then you cannot do an MRI. Otherwise, there is no contraindication to do an MRI. It's very safe. Coming to the question of whether we should do a routine MRI if you are a sports person, not indicated as
Mm-hmm.
of today. Okay, so even if you are a
Mm,
very, very active sports person, there is no scientific evidence as of today to suggest that you should go an annual MRI to just see and
mm,
anticipate and all
mm,
that. So unless you are symptomatic or you have a very particular complaint which kind of tells us clinically that there is a problem in your spine, we don't have to do that. Obviously, you have to do all the training and the precautions that you do in your particular sport. I'm sure that you will be doing that. So once you do that and you are fit, we don't have to do an annual MRI to check. That stage has not yet reached.
right.
I cannot predict. Maybe we will have a stage where they say, like your blood health check regularly, you do an angiogram, you do an MRI. Things may evolve to that, but as of today, we don't have to do that.
Got it. As long as you don't have a chronic back pain and you don't have any acute issues which is because of a trauma, and probably you're active, then don't need it. So I think again I want to touch on specific symptoms at this age in 2025, right? Because I see a lot of scoliosis is being diagnosed, be it in pediatric. I mean, especially recent because of the maybe awareness. A lot of during the pediatric checkups, a lot of scoliosis is being, at least they wanted to check for that deformities. So, how do you see that? Do you think again? I wanted to understand the reasons for it, or maybe is it so unknown, and how percentage of the increase you've seen it in the child or probably in
Yeah,
the
see,
adult cases?
scoliosis, basically, what is scoliosis? Scoliosis, like I already described to you in the beginning, the spine has very specific curvatures, right? So there is a cervical kyphosis, dorsal kyphosis, and lumbar lordosis. But the spine is reasonably in the center. When you look it from the front,
Mm,
it is exactly straight. Only when you look from the side,
right.
that's the time, like if you look from the front like this, it will look
Yes.
straight. Yeah. Only when you look from the
This
side, you
size.
will see the curves. So in
Yeah.
scoliosis, what happens? This is not straight. So the upper part is on one side, the lower part is on another side. So in the
Mm,
coronal plane or the front and back plane, there is a tilt of the spine. So that is what is scoliosis. So is it common?
scoliosis.
Yes, it is common. It's maybe about say 1 in 100,000 or 1 in 10,000 kids can have it. Is it something that is worrying? No, many of these scoliosis are
Mm,
just incidental findings. That means, like you said, because of the awareness, you do a chest x-ray for some other reason, you have a cough, you have a cold, or you have some pneumonia, you do a chest x-ray, you see the spine, there is a curvature, you have low backache, you do a spine x-ray, you see the curvature. All of them does not mean that you need immediate treatment. There are some scoliosis which become severe. So when they become severe, especially the thoracic kyphosis becomes worse. Their one side of the lung does not
mm,
develop at all because of the scoliosis. They develop a hump-like deformity in the back.
right.
They have a shoulder, one shoulder is up, one shoulder is down, all of us must have seen these kind of people all around us throughout our life. So these are the conditions in which we have to identify the curvature. And even for scoliosis, we have really very good advanced treatments right now where we can correct it significantly. The curvature is calculated very scientifically with various parameters, and how much of it can we correct is also planned, and it's meticulously planned on the navigation systems, and the safety of the procedure has significantly improved. So when we give anesthesia and do this procedure for scoliosis, it's a long surgery. So we want to make sure that the patient's nerves are intact. So now we have a technology which is called as intraoperative neuromonitoring. That means even during surgery, I'm constantly getting feedbacks from those nerves, which I'm putting screws into those bones, whether they are working or whether the screw is touching any nerve. So that way, the safety of the whole correction procedure is also significantly improved.
Got it. I think it also depends on the percentage of the grade where you really need any treatment or
Correct.
not. It's not that
Yeah.
all the time. If it's very negligible, I don't think so. There is any
You don't have to
treatment
do it.
required
Exactly.
to.
That's what I'm saying. Yeah. So degenerative scoliosis is another thing. So as you age, there is a pressure on various parts of this bone, right? Depending if you somebody is somebody who's always sitting like this and working, somebody is not sitting straight.
Hmm.
So all these things can affect the spine in a different way. So you can have what is called as degenerative scoliosis. So as you age,
Hmm.
your spine was normal when you were a child, but because of your abnormal posture and the way you have worked or where you have used your back, there can be curvature which get changed. So some of them may need surgery to correct it, and some of them can be managed just medically.
How much percentage of that is more of degenerative scoliosis, doctor? I mean, do you see that it's more with this current generation, like a lot of laptops and working
Yes.
involved during the childhood? Because I don't think so. We had that during our childhood. Maybe it's not diagnosed, or probably people didn't notice because of the posture. But I think we didn't had so much of abuse of the spine with different postures and lying and reading
Correct.
mobile. So
Correct.
do you think that the childhood spine is still developed between like until they
Until the age
grow
of
out of the
18, yeah.
teenage?
Until the age of 18, or for ladies, usually we say till they attain menarche. So definitely that is a problem. So it's not necessarily only the lower back. I feel the bigger problem is the neck. That's what we see. Most of the time they're looking up or they're looking down like this in the phone all the time. They don't keep their head straight. And some of them keep the phone like this and then talk all the time, bend their head. They don't keep it straight and talk. They bend their head and
Hmm.
talk. They try to hold it between their shoulder and the neck. So those are the conditions in which, obviously, in today's age, 2025, we see significant amount of pain in the neck and the hand and all that. So that is primarily muscular many times, thankfully. So if they persist and they don't take care, then can secondarily start involving the nerves and the disc, and then that can
Hmm.
become dangerous and you will have to treat it surgically.
Right. I think I have this picture with me, which I had a question on. So I think the texting or probably the cervical spine is actually abused by the use of mobile in the
Absolutely.
current last 10-15 years, but I think today it's so much but everybody is like this. So
Exactly.
have you seen such impact from how many of that you see from a it is actually impacted so much that they have changed the structure of the.
No, it's not a question of structure, Naga. What has happened now is that if you're asking me how much of that has changed, it's changed significantly. I see so many children coming to us with neck pain, which probably you would have never seen
Okay.
because the children were playing outdoor sports, right? They would play football, they would play badminton, they would play cricket, whatever sport, and they were doing all kinds of activity. Now, like you said, if you go in a train, bus, or go home and sit in front of family, all of them have their own gadgets and everybody is looking down. Nobody is even talking to you, looking at your eyes, right? So that is the challenge, and the cervical spine is a very, very sensitive spine. Even though God has made it so good, if you continue to abuse it, like if you're traveling, you can see that, right? All of us in the aeroplane or when
Hmm.
you're traveling in any mode of transport,
Everywhere, yeah.
yeah, you're always looking down. You don't keep it like this in front of your eyes. You always try to do this, right? So that's not good. So we do see an increase in the number of patients complaining about back pain, especially neck pain. And some of them, like I told you, if they don't take care, the neck pain worsens and then they start getting radicular pain in the hands, and that's the time when the danger signs sets in, and then we have to start investigating them with MRI and then do appropriate therapy for that.
Well, I think I also have this the text neck and ligament creeps, which is I read about in one of the public medical publications, right? Because the texting and walking, so that's been a very common phenomenon at this age. People continue to do it, even though there is a lot of impact. So I think the injuries are, but it's very unknown. Probably don't realize until it progresses to a stage where it has become a chronic neck
Absolutely.
pain or back pain, as you
Yeah.
say.
So see, basically,
Yeah.
like you said, texting while walking is another big bane right now. People are all the time looking at the phone, even if they're doing walking. And then they say, I was walking, doctor. I walk every day 2 kilometers, 3 kilometers. I don't know how I developed this. This is what happens, right? So you are repetitively trauma. That is what is the technical word that we use. This is called repetitive
Yeah.
trauma. So your joints are all the time moving in the wrong directions and looking down. There is stress on that ligament. There is stress on that joint. And then obviously at one point in time, the compensation gives way. And when the compensation gives way, that's the time when you start seeing symptoms. So it's an absolute no. Please do not do that. If you want to listen to music with an ear pod or something and look straight and walk, please have a good posture even while walking. Don't look down, text and walk. You may fall down. That is another big issue, right? You are watching your phone. There may be something on the road which you miss out.
No, it's not just only the problem for you, it's for everybody else around. Even when you're driving, like people are looking at it, and then it's become a major problem for every
Major
other
problem, yeah.
passengers. Moving from scoliosis and that the cervical related issues, that spondylolysis, right? That's one thing which I was, when I was trying to research about the specific issues which people most commonly, it is not probably understood, or it's probably overlooked, because a lot of sports, or what I understand is most of the people who are more gymnasts or probably dancers, who are probably more moving or movement or bending, flexing their spines, has developed over a period of time spondylolysis. Is it right? Or I
Yeah.
just wanted
So
to
no,
get your.
basically you need to know what is spondylolysis, right? So I've again used this model to just explain to you. So you have this bone, okay? So this is called as the pars bone, okay? So if you have a defect in this bone, like we have shown in this model here, so there is a defect in this bone. So it can be
Hmm,
congenital. That means you were born with this defect. So the way these
hmm,
bones are formed in children is in a very very different way, which I'm sure is too much of a scientific knowledge to explain. So there are multiple centers. So one bone comes from the front, one bone comes from the back, so they all then join together and form the full spine. So if there is improper growth of one particular bone, then you can have what is called a spondylolysis. So what happens in spondylolysis is like this. So we have seen that. So one bone moves front and one bone moves back. So the bones are not
hmm.
in line. So one bone is front, one bone is back. So that is what is called as spondylolysis, like what you're saying very classically. So does that happen in gymnast a little more, or people who are athletic? Not necessarily always. So obviously there is a more stress on these guys back, because they are doing all this high energy and high intense workouts. But many of them are well trained. Their muscles are very well toned. They don't have high body weight. They don't have obesity. So then the chances of that developing may be less. So it's more to do with trauma, more to do with congenitally having a defect in the particular bone called as the pars.
Yes, got it. Thank you, doctor. So again, from a bone health standpoint, right? Coming to that, lot of not many. While everybody says, we are calcium dense and we have enough supplements and we are eating well and all that, but then the not many do the bone density check as well. So when you do that, you find out it is less. So do you see that as a common problem in everybody who comes to? But I mean, first thing you recommend to also check that. If
Yeah,
I just want to get your
exactly.
perspective.
I'm sure you must have researched that, Naga. So the previous trend was that everybody should start taking calcium after you reach say 40 or something, because your bones are automatically weak. So we have moved far away from that. So even if you ask my orthopedics colleague, they don't prescribe calcium to every patient who walks into their OPD. So that era is gone. So because now we know with scientific research and publication that you have to, like you said, you have to check your calcium levels. So if your calcium levels are normal, you may not need any calcium supplement, because this calcium
Mm.
need not necessarily go into the bones. They can go into your kidney, they
The
can go into your
perf.
gallbladder, and then they can cause stones
Yeah.
and other problems because of hypercalcemia. That's what we call, when the calcium level becomes more, it's called hypercalcemia. So not necessarily everybody needs a calcium, but there are definite indications for giving calcium. So nowadays we have what is called as a DEXA scan, which is a very very good scan to check your risk for
Great.
fractures. It estimates the amount of osteoporosis, or how fragile your bone has become, with a very very scientific way. And we know that if your bone fracture risk is much higher, or your osteoporosis is significantly high, then you may need supplements, not necessarily only calcium, but also other bone
Mm.
building important things. One of the most important things in that is vitamin D. So if your vitamin D is
Yeah.
low and you just swallow calcium, it will not help. So you have to have a correct balance of both the things in the body so that you have enough calcium absorption and your bone becomes stronger.
Get some sunlight.
Yes,
Go out.
exactly. And in women, especially, calcium can be low, especially people who have had early hysterectomy and removal of both the ovaries. So the hormonal problem that can cause in elderly ladies or people who are postmenopausal can also lead to a calcium deficiency. So in them, definitely we would recommend to take calcium supplements.
Okay. Yeah. Thank you, doctor. That's very, important to know, because it's not like everybody just says, okay, I'm supplementing without knowing that whether it's a need or not. Check your calcium levels frequently to make sure that and get a doctor's opinion before you just supplement yourself. So as you say, anything more also is not good. Um, I think the next topic I wanted to touch is on sitting is the new smoking. So I think I wanted to get or create awareness or get your perspective on, how do you see how far it has gone, and any extreme patients you have seen in terms of, because of that it is even a surgery has led to surgery. Maybe anything examples you want to talk about,
Exactly.
right?
So,
So
yeah.
because it's important.
Yeah. Sitting is smoking. Yeah, that is very, very important. It's not only necessarily for the spine. Today is actually World Heart Day, just to let everybody know. So that is the kind of don't miss a beat is the theme for this year's World Heart Day. So they always keep talking about that. Sitting is the next smoking for all the patients who have problems in their heart. So we see that very often now with people who are all on these desk kind of jobs. They are not moving. They have to sit at a time for 6 hours, 8 hours, even longer sometimes, and not doing any activity. So that kind of really puts stress not only on your back but on other organs of the body. Coming specifically to the back, yes, because if you're going to sit for 6 hours, 7 hours, obviously you're going to slouch over a period of time, right? How long are you going to be like really erect, sit properly, keep your shoulders level? So it's a normal body phenomena, right? Your body muscles will go into a spasm. So you want to relax that. You start turning to one side, you will become straight. So this keeps happening as you keep sitting for a long time. The next, obviously, once you're not moving, you'll put on weight. So once there is obesity, the vicious cycle starts. So once there is obesity, your disc problems will start. You will put on more weight. The spondylolysis will start showing up. So all this as definitely can lead to a severe problem which needs surgery. If you're asking me specifically, have I seen? Yes, I have had a child who was only 14 or 15. During COVID time, this was. So for those 2 years, he was only doing online school, all the time eating junk food because parents wanted to pamper them. They were not going out. They were just feeding them all this junk food at home, and he became so obese. And one sudden day, he bent to just lift something, and something popped in his back, and he had a huge disc. And we had to do a microsurgery to remove that and relieve him of that pain because the pain was so unbearable. So definitely, if you just continue to sit and get into that vicious cycle, it can lead to a situation which can end up in having some kind of a surgical problem.
Oh, that. Yeah, I think the child developing that, it's again anything. I from a personal experience, I know anything you touch, the spine. So it's the core part of your system, right? It's a lot of times when you see people who are immobile because of such issues to accidents, and they've had deformities and spine issues. So I think you see that only one life and one body. So
Correct.
please take care of that with
Correct.
right posture and don't abuse it.
Exactly. But I want to clarify that please don't get into that fear mode, right? So that you have one spine, but if you have abused it in some point of time in your life and you want to get back to your previous normal life, please consult the doctor. There are very
Right.
good solutions, and like I told you, that era is gone. I mean, I remember even now, tomorrow, day after, I may again see those kind of patients who come to me and say, doctor, please don't touch my spine. I know that if you touch my spine, I will become paralyzed. Give me only medicine. But what is happening? They are getting into this vicious cycle. Because of the pain, they are not able to walk. Because they are not walking, they're getting more weight. And because of the
Right.
more weight, the
Correct.
pain problem becomes worse. So we have to break the cycle in many of them. Please do not get worried. Like I was just telling you in the beginning, we have a lot of advanced therapies wherein we don't destroy the core strength of the muscles in the back. With preservation of that strength in the muscles in the back, we can do a good job and relieve you of your pain and make you walk in a way that you were doing before this problem.
Yeah, I mean, it is not that because it probably it depends on the kind of person. Let's say if somebody who's actually I mean, has an athlete, or probably who's a construction worker, the impact is so much because they had to go out and do some physical work. But let's say somebody who's not, maybe just doing some teaching or probably not actively using their body, the impact may be low. So they may just say ignore it for a while and not do surgery because I don't have to.
Correct.
So that's also a very myth which people. It's not like when you push like anything which you push it for later,
No, I
it's
think
going to become worse.
yeah, what you're saying is very important, Naga. See, what happens in patients, some are people who are lifting weights, who are working in civil line, who are regularly lifting weights, or people who are regularly lifting weights in gym, their muscles are toned. You understand? So the chances of them developing a back problem are much lesser compared to somebody who suddenly decides in 1 week, I want to lose 5 kgs, in 1 week, I want to do this, I want to lift deadlift, I want to do bench press. So that is the challenge which we see. So in these patients who suddenly want to become very hyperactive and start doing things which they've never done before, that's the situation when you'll end up in having some kind of a surgical issue. If you're somebody who was probably regularly doing this, I mean, you may have seen these guys who carry these dolis, whether it is in Vaishno Devi or whether it is
Right.
in some other, these guys have such strong muscles, right? So they are somebody who is regularly doing, they may never develop a disc problem even if they lift 100 kgs, 20 kgs, 30 kgs. But somebody like you and me who don't lift regularly more than 15 or 20 kgs in the gym, if we try to do something unusual, we will end up having problems. So that is the important message. Don't do anything that is very, very sudden and stressful on your back. Do everything in a very, very gradual and in some probably under the guidance of a trainer. It's much better.
Yeah, that's right.
If you made it this far, you're clearly into deep, meaningful conversations around health, lifestyle, and the science behind how we. 60% of people who watch these episodes haven't subscribed yet. If you enjoy these insights, my humble request is to please consider hitting that subscribe button. It will help us bring much more curious minds, expert voices, and keep the show going. Thank you.
I think it's also it's also important to actually understand what will work for you from a posture standpoint, right? And using an ergonomic chair, what are the things which you can do to actually support your spine and back instead of creating that chronic or issues forever. So those things you need to, as you say, looking at the mobile, keeping it trained, and are probably working keeping the desk and the laptop in a place where it is actually in front of you, not just low or high. So especially I've seen a lot of times the television is also a problem in a lot of houses because it's not in the right placement.
Correct.
Either it's up or it's too low. So that's also is a constant impact to your cervic spine.
Absolutely,
So
absolutely, Naga. Yeah, because TV also is very important. You keep it very low on a TV desk or something like that, and you're looking down like this for the TV is bad. Looking it very high. So when you fix these TVs, please make sure that they're at the eye level and at correct distance so that you get good relief. So it's extremely important posture. Like you said, back support is very, very important. I and may not be me only, but all our spine surgeon doctors, we tell them that please have good back support. And you must have seen most of the chairs have the same kind of a curvature that we have normally in the spine. So that kind of really gives that support in the lower lumbar lordosis spine so that you don't excessively bend front or you don't excessively slouch. So that is very important to have appropriate ergonomic chairs, appropriate ergonomic desks so that you don't keep your hand up, you keep it like this. So all these are very, very important points that you have raised, and that will make a long way in preventing any kind of spine problems in future.
I think the last point I wanted to touch upon, that awareness is actually on how much of I mean lack of sleep, and also because there's a lot of attributes to more of a chronic pain. It's not right. Let's say smoking, because that also nicotine actually stops the blood flow to the spine. So I think there are a lot of not many people really correlate all these to such, right. So I think I wanted to get your perspective on some of the very unknown factors which actually will have an impact on your chronic back pain. Maybe you want to
Yeah,
share.
absolutely. Smoking, like you said, is very, very big risk factor for backache. We know that the disc degenerates much faster in patients who smoke. So when there is a much more faster degeneration, it can't take the stress that you do. When you do normal activities, like when you bend, actually the stress on the back is so high. So if you unnecessarily keep bending and you are continuing to smoke, the degeneration sets in much faster, and you can have significant problems. People don't realize, they always think smoking means it affects only the lung and the heart. Not necessarily, it affects a lot of other organs, and spine is a very, very important structure that gets affected in patients who smoke regularly. Similarly, patients who do repeated minor trauma, that means you don't take proper kind of a training or strengthening your back muscles. So if you don't strengthen your back muscles and you continue to abuse them, you keep bending, you do things like lying down on the floor and mopping the floor, or standing and mopping the floor too much, all these also can definitely cause worsening, which you will think that, oh, I'm very fit, that's why I'm doing it, I don't have any problem when I'm doing it. But it's not true. The stress on the back is going on adding, and like I told you, at one particular point that balance may get shifted, and then you may start having symptoms.
Thank you, doctor. So on the hospitals and probably the support systems around the spine and the rehabilitation, because that is one point I wanted to really talk about, because that's an important, because it takes a lot of time for a person who has gone to through a surgery to actually recover, and then how that is supporting, how do you see those programs are also the rehabilitation centers, or helping maybe talk about that and what is important, because it's not just surgery and then the consultation after that, the physiotherapy and post
Exactly, Naga.
uh,
Very, very important
surgery.
point. What you're saying is absolutely true. So, like you said, there has been a significant advancement even in terms of rehab. We have walking robots. Many of you may have read about it. So, these are the robots, especially in patients who have had partial spinal cord injuries. So, when I mean partial spinal cord injuries, is like these people have some strength in their hands and legs. So, it's not zero. It's not like they're completely paralyzed. They have some strength. The nerve was just stretched or the nerve was just hit, and when we do a surgery and relieve the compression or improve that circulation in the spinal cord or the nerve, after that the next most important step is rehabilitation. So you have to target each group of muscles very specifically and then work extensively on them in various ways. I think that itself is a separate podcast where we have extensive data now. Yeah, so there is so much data in terms of AI. So when you have a problem, the AI will first, they make you walk, and then they will analyze all the problems that you are having, and this
Hmm.
will make sure and compute all that algorithms and tell you, okay, this is your gait problem, your left leg was not moving properly, your knee was getting
Yeah.
buckling, your toe was not lifting up. So this gait analysis is a big thing now in rehab. So before we give them an appropriate or a very patient specific rehab, this gait analysis is extensively done. Each group of muscles are worked on extensively, and also robo legs. So people who are actually paralyzed, they have these robo attachments, and that will keep pushing the leg and make them move each step. So there is a brilliant advancement in rehab. And does it mean that every patient who undergoes, say somebody who has a small disc problem, does he need this kind of high-end rehab? No. Somebody who has a minor disc problem and underwent a microscopic surgery, or somebody who had degenerative problem in the spine, underwent fixing of the spine, they don't have to go on these kind of advanced rehab, but definitely they have to strengthen their core muscles like we keep talking. So they have to do exercises which improve their back, reduce weight, and do things that will help their back protection and not worsen it. So those are the things that everybody has to do.
I think you made a very valid point. Strengthening the core muscles, I think it's very important for the back. So not many know that, you have a strong core, then actually it's supporting your back when you build that. And I also wanted to quickly get that. See, when you have a surgery, that's a very major spinal surgery. The scar tissues gets built up. Let's say every surgery there is, but especially on the spine. But do you think it takes a long time to get that scar tissues gone, or today's with non-invasive or probably less invasive procedures, it's actually low than compared to 20 years back.
Yeah,
So
definitely. Like I told you, we don't cut the muscle so much in all these minimally invasive procedures.
mm,
So the scarring is significantly less. So it's not like zero, like you said, there is going to be some scar.
mm,
But obviously now we have more and more advanced techniques in which we know that we can reduce the scar tissue. And not everybody forms a similar type of scar, right? So some of them may not have any
yeah,
significant scar at all. And somebody who has had a small surgery also may have a significant scar. So that is definitely there. You need to work on the core muscles, and swimming is a very, very important exercise which helps you to train the core muscle. So it is very good for the back, very good for your abdominal cores. So people who see swimmers, they usually have very strong backs.
yeah, great. Yeah, I don't know, I think good point you added. I think I just wanted to, because there's a constant once you cut, because the people are not, they don't know or not, but the scar tissues, how it develops, it varies from person to person, and the recovery is on depending on that. Okay, thank you, doctor. I think last question before we move to my set of rapid fire is that, so from a upcoming Gen Z or new doctors who wanted to take up the spine, or especially neurosurgery you talked about last time, but spine as a specialty, what are the top three things which they need to be focusing on at this point, right? And be it attending to patients or even for themselves.
So obviously, spine surgery training is a part of neurosurgical training, Naga, as of now. Okay, whereas when it comes to
Mm.
orthopedics, many of them take it as a subspecialty. That means they would do the rest
Specialty.
of the trauma orthopedics and the joint replacement orthopedics. In addition, some of them develop a special interest and then they don't do the other two and they do only spine. So that's what we see even in the
Mm.
West, and even in India, it's now catching up, where a lot of orthopedic surgeons are doing spine surgery. But still, neurosurgeons are the ones who are usually doing spine surgery because it's a part of the training. So if you are somebody who is a general surgeon or who is an upcoming surgeon who wants to do spine surgery, obviously going through the neurosurgical training program is one of the best options. So I would suggest them to do that. If you are already an orthopedic surgeon and you want to do spine surgery, definitely that is also a very good option. We have excellent centers all over India and the West now where you can train exclusively in spine surgery. Obviously, it needs a lot of attention and focus. You have to be very meticulous. You need to know a lot of biomechanics and physics in addition to your regular medical subjects so that you
Yeah.
understand this correction of the curvature, you understand where the balance of the spine is, and also know all about the technology that was tying. That was the third important point. So you need to be really aware
Mm.
and up to date in addition to taking the training program. Be very meticulous and be aware of other subjects in addition to medicine. And the third point is to be able to use the technology that is available right now. So if you say, I don't know how to use the AI machine, I don't know how to use the navigation, I don't know how to use the robo, you may not be able to survive. So this is an era where you have to know how to use the AI for your own benefit and for your patients' good results, and also know all about the current technology that is available right now.
Thank you. I think it's very true. As you said, you talked about the spinal cord stimulation example last time, right? So I think some of the advancements are actually groundbreaking, and it's actually helping. And there's a long way to go, right? It's more and more is going to come with
Yeah,
that, with the
yeah.
research, more research and funding
Absolutely.
on that
Spinal cord
space.
stimulation is going to be a path breaker. It's already happening in the rest of the world.
Yeah.
For so many pain, like I told you, in spite of having all this advanced imaging, many a times we may not be able to pinpoint the cause of the pain. The brain is designed in a way where the information from the spinal cord goes up to the brain and then the patient perceives pain. So what this information that is going up into the brain, we can modulate by doing the spinal cord stimulation. So when we modulate that symptom that is going to the brain, the patient stops perceiving the pain. So that's the beauty of the spinal cord stimulation, and there is a significant role. I'm sure it will come up in a big way in the future.
Thank you so much, doctor. I think I know definitely you can't compress the entire spine into an hour, but I think I was able to get what is important from a spine health and posture and what is relevant at this age in time. So thank you for sharing that. So I my last segment is spine sparks. I'm just trying to have a fun set of questions or different areas, so we'll get a quick answer from you, right? You probably might have covered some of them in the previous discussions, but I'll start with one myth about back pain you would bust in 5 words.
The myth is
Or one word, what?
yeah, the one word important thing about back pain is something that can be taken care of. So please don't assume that every back pain is something that you have to live with. Please don't do that. Please take appropriate therapy. Your back pain, whether it is coming from the muscle, whether it's coming from the bone, whether it's coming from the nerves, these are the three important structures, can be specifically addressed. So please don't get worried and just don't go into a shell. Come out, take an appropriate therapy, and you'll do well.
Yeah, thank you. True. One exercise everyone should do daily for their spine. You said swimming, is that?
Yeah, swimming is very, very good. That is very important. If you cannot swim, you are somebody who has never learned swimming, you have to do what is called a stretching. It could be yoga, like Surya Namaskar is a very good exercise for the back. Or you can just Google them. They're all stretching exercises. You lift your leg up, count till 10, lift the other
Yes.
leg up, count till 10. So
Mm.
strengthen the core muscles, the same thing that we have been talking about. Instead of swimming, use other exercises to strengthen your core muscles. That is the most important thing.
Okay, so I think this is a very easy one. I think we all discussed already. One gadget harming our spines today.
Yeah, we all know it's the mobile. Yeah.
Mobile phones, right? Nothing else. Our technology is one way helping in terms of the improving the what happens after a trauma, or probably, but the impact is also the other side, right? The one is creating that issue is also the technology.
Absolutely. So it's like two sides of the
So
same coin. Yeah. So you have a problem
yeah,
because of excessive use of technology in terms of mobile phone and others. And the other extreme is you have these wonderful technologies that are helping us to deliver more precision, more safer care to the patients. Yeah. So it is there. Both of them are there.
so one posture mistake you see everywhere,
Yeah, posture mistake commonest that I see is the slouching. People don't sit
slouching.
properly erect in the chair.
Yeah,
Maybe because I can't blame them. Some of them say, sir, how do you expect me to stay like this, like a robo for 6 hours and type like this? I will do like this. So that is the commonest thing that I see. And so that's what I tell them. I say, please don't sit for 6 hours. After every half an hour, get up, walk for 5 minutes and
get up.
come back. So then at least you have a little more energy to correct your posture and be straight. And this continuous stress on the back becomes significantly less.
Yeah, I think slouching. I've practiced to sit straight almost because of because I know sometimes when you go through it's very early, you make sure that you sit. So it's a practice. And I think one more thing I wanted to check with you, when sleeping, right? When you just sleep straight in the bed, the spine doesn't touch the ground. So I think I practice this. I was told by Dr. Long back that put a pillow under your thigh
Correct.
so that you give rest to the spine. That way it's little elevated. So is it true, right?
Everybody don't have to do it. So you see in the market, right? So there are all these hi-fi spine mattresses, ortho care mattresses, which will touch your curvature and all that. Yeah, so it's not necessarily true. You use a mattress which is reasonably firm. Don't use something that is extremely
Hmm.
soft where you just sink into the mattress. So when you happens
Yeah,
that, so
correct.
that's where your lordosis becomes more, your kyphosis become more, and you
Hmm.
get more stress. If you are somebody who sleeps on the side, please use two pillows. Cover your distance from the head to the shoulder. Your head should not go like this. So that is another common myth that I want to clarify. People think that you should sleep on the floor without pillow if you have back pain or neck pain. That is a myth. Please do not do that. Use something that is comfortable, because the more you do that, the more the muscles will get stretched and your pain will only get worse. So please use a correct pillow. If you are somebody who sleeps in the side, you can even use two pillows. Nothing wrong. Like you said, somebody who's
Yeah.
having chronic back pain or lordosis is more, they can use a pillow under the thigh, and that will help to correct it during sleep. It's a very good thing to do.
One food you'd call brain and spine friendly. Okay, I think many, I think, but anything
Yeah,
specifically
there is
you
nothing
have,
specific. Yeah,
like people talk about matcha is a brain. It's I think a lot of new fancy food has come now.
exactly. There is no end to these fancy foods, Naga. Now right? From whey protein to omega-3 fatty acids to walnuts to whatever you can say. So my recommendation is there is no one superfood. Please eat what is healthy, what is locally available. That's the current trend. If you
Yes.
ask me, you don't have to eat an avocado in India now. That's the big fancy thing in India now. Everybody wants to eat avocado salad, avocado, smoothies. So it's not necessarily true. Eat what is locally available, eat in moderate quantities, and eat healthy. I think that is the message.
Right. Yeah. Thank you. So one future technology you're most excited about in spine, I think you talked about, is it like the robotic
Yes, one is,
rehab?
yeah, one is the rehab improvement, which we're already seeing it. And the other important thing,
Mm.
like I was telling you, is about the expansion of the indications for spinal cord stimulation. So it is going to make a difference. We are all on that verge where things are moving very fast, and we may see a wide variety of conditions which we can treat with more advanced therapies.
Okay. So the next is like, I just want quick this or that, standing desk or ergonomic chair.
I would prefer ergonomic chair. Standing desk can lead to what is called as varicose veins over a period of time. It's not
Long,
necessarily
long
only
time.
on your back. You stand for long hours every day, 8 hours, thinking I'm standing, my back is safe. No, you may develop other problems like varicose vein, which is a common problem.
Right. Yeah. I think you're putting so much pressure on your lower, I mean, the calf muscles. Yeah. Yeah. Yoga versus Pilates. Pilates. Yeah.
Like I told you, both are good.
Both are,
Both are good. So whatever suits you, whatever makes you more
yeah.
comfortable, you can do that.
Robotics versus AI in spine surgery.
AI in spine surgery is
Robot.
part of robotics. Yeah. So
Yeah.
it's completely, the robo relies on all the information that we provide the
Which
CT
comes
yeah,
through AI.
and then it comes through AI and
It's a
analyzes and tells you.
combination of both. Yeah.
Exactly, it's a combination of both.
Endoscopic versus open surgery.
Yeah, so that is another big topic, right? So there is a fancy to do endoscopy for everything now, if you ask me, but there are very specific
Okay.
indications. So I think as neurosurgeon, it's my duty to tell you that each case has a very specific indication. So what probably we would have done open previously, now we have an option of using endoscopy. So please select your case correctly. Endoscopy obviously is much more minimally invasive. So in an ideally selected cases, it's better to do endoscopy.
Got it. I think this is like, I know, I just want to hear, but prevention versus rehab, I'd say
Prevention any day.
always prevention
Prevention.
is better than cure.
Absolutely. Absolutely. Whatever said and done, you don't want to
In
do.
2020, yeah, sorry, go ahead.
Whatever said and done, you don't want to, make your back go through the trauma of going into surgery, rehab, everything, right? If you can avoid that, that's the
Rehab,
best.
yes. As much, yes.
Yeah.
True. In 2035, let's say young surgeon will need to know, let's say in 10 years, like what is that one thing you will not compromise?
No, I think,
Technology?
yeah, technology is obviously one thing. There may be much more advancements than what we are seeing. There may be more robots who are performing the spine surgeries. But definitely the basics don't change, Naga. Even in 10 years down the line, the basic thing is to make it as safe and as beneficial for the patient. I think that's what I would say even at 2035. Use a technology or whatever device that you have which is safe and which is beneficial.
Right. Yeah, I think it's a important point you brought up, safe. It's not just the fancy of technology, but it's how safe the technology is for the patients. It's very important, right? How much ever advancements you do, right? So one sentence of advice for young neurosurgeons. That's the
Yeah.
um, last question.
So the important thing is if you would like to do, like I already told, everybody is exposed to spine surgery. So if somebody wants to do it exclusively as a spine surgery, I'm saying this is the time. So we are reaching a stage where people in neurosurgery are subspecializing to do only spine surgery, and
No,
it's a
only
very
spine.
active field.
Hmm.
So I'm sure, and it's a very, very common problem, like we already discussed throughout our podcast. It's a very, very common problem that we see, and will give you a lot of satisfaction once your patient does well. So that is the message for young students. Please learn, train, use the technology to the optimum so that it becomes safer and good for the patient. So that is the message.
All right. Thank you, doctor. I think that's about it, and I think I probably learned a lot. I mean, while this is a very personal journey for me as well as the spine for the last 35 plus, more than that. So I think your information at this age also is like very relevant in terms of while technology has improved, but even today people have to focus, right? I mean, personal choice of doing the right thing for your spine is very important, because I know that a lot of times people don't care. From childhood there is no awareness or knowledge created by the parents or the children, in terms of sitting straight, or while as that, I mean, you also said like, why, how would I sit like a robo for so long? I said
Correct.
that
So
that's
that's one important thing that you've said is absolutely we need to inculcate this to our children at a much younger age so that when they reach the age where it starts developing, we can prevent that from happening. So if you started say when they're like in second grade or third grade, so by the time they are like adult or teens, that time the problems will not happen. So at least they have been in
right.
a system which has taught them the right things to do, how to maintain posture and all that. And obviously the other big myth is for anybody who is having back pain to go to this non other practitioners. I know in US and the West the chiropractors are a very well trained kind of a guys, so there is a big thing that itself is another topic, whereas in a country like ours where we are developing, that is still a challenge. So you may have to be very, very careful when you choose these kind of alternative therapies. My advice is to be extremely careful and do your research, or probably take an opinion from your doctor before you venture into all these alternative therapies.
I think there's a lot of, that's a big topic. There's a cast they put in, right, in the that yeah, I mean, not everything could be treated like that, and I don't think so. There's very developed. They do scans or probably do all that sorts of diagnosis before.
Yeah, no, we have had patients who have come back. Yeah, we have had patients who have tried that and come to us with worse complications, developing weakness of all four limbs and all that. So that's why I'm saying that you need to really do a research and know what the kind of person is doing and what is the therapy that they're offering you.
Thank you, doctor. Thank you so much. It was such a, I mean, I would say mind-blowing conversation, and I think it's your wisdom speaks a lot, and thank you so much for doing it today, and sharing all your knowledge on brain and now spine. So I'm so thankful and grateful for that.
Thank you, Naga, for having me on this podcast about spine. It's always interesting to speak and raise awareness. And thank you so much for having me on your show.
Thank you, doctor.
Thank you.
Have a wonderful rest of the day.
Thank you.
If you made it this far, you're clearly into deep, meaningful conversations around health, lifestyle, and the science behind how we. 60% of people who watch these episodes haven't subscribed yet. If you enjoy these insights, my humble request is to please consider hitting that subscribe button. It will help us bring much more curious minds, expert voices, and keep the show going. Thank you.